Hi, I'm really glad that you're invested enough in taking care of yourself that you would take the time to listen to this presentation so that you can learn how to do a better job of just that. For those of us that haven't met yet, my name is Nancy Tickenoff. How I came to be interested in, okay, it's more like borderline obsessed, uh, and emotional health is a result of both my own personal experiences and having worked in healthcare for the past 45 years. I started out taking care of people's physical health as a registered nurse. And after a short time, when I saw that the majority of illnesses were emotion related and they needed to be addressed holistically, meaning not just considering the body alone in our assessments and treatment plans, I went back to school and I got further education as a counselor, wanting to add this piece to better understand and give options to my clients. Then I added coaching certifications in health and wellness and life coaching to offer even more options to people that are interested in getting and staying emotionally healthy. So, what I saw and experienced in working with people and also due to my own journey is why I do what I do today, which is to educate and empower people to live emotionally free. So I'm thrilled to be that you're tuned in and to be able to talk with you about my favorite subject. I do want to let you know this is just a high level overview. And so we will get started. Let me share my. Okay, so in Western society, at least in traditional Western culture, I'd actually classify our culture as emotion phobic almost, because in many cases, our culture, at least in America where I live, discourages the expression of emotions. And in many cases, it actually discourages people even experiencing or feeling their emotions. We're so uncomfortable, we don't even want people to do that. And people who do express them could be categorized as weak, needy, dependent, and all those other adjectives that Western society abhors. We're afraid of the results that we're going to get. Like this puppy here who found the paintbrush and the paints. We just don't know what kind of results we're going to get. And so we're afraid that it's going to be out of our control and we're not going to be able to handle it. So let me take a moment here to reassure you that I understand the fear of both feeling and expressing emotions. So in no way am I judging anyone about anything emotional here, whether uh, lack of expressing or over expressing. So going forward, please understand that I'm just making observations of behavior only when I talk about these things. We ignore and exclude emotional expression at our peril, however, because you see, feelings will be expressed and they could be expressed at sometimes a very exorbitant price that we're not going to want to pay. There is a cost to be paid, and the payment may come due suddenly and in such a way that we would not prefer. Because you see, emotions don't simply dissipate out into the air. If not expressed, they are actually stored in our body, in our muscle tissues, in our brain, our stomach lining, and other places. Remember that emotions are energy, and per Einstein, energy is never destroyed, it only changes form. So, hindered, repressed, suppressed emotions can only be changed in form. So, if they're not expressed, they're going to be stored in our body. Just like your Christmas tree is put up in the foyer and all decorated, and then later you put it in a storage box and you put it in the attic. That don't mean the Christmas tree went away. It just means it's stored. But this repression and suppression of emotions and this lack of expression costs us our physical and mental health. For employers, if you are an employer, this equates to loss of job productivity, profits, low morale. If you're in the school system, you're going to see children hindered in their ability to learn. And for the healthcare reimbursement system, the side that I've been used to, I see this costing millions and millions of dollars in medical and mental health care. It also has the effect of straining our providers to provide care because the root cause of so many physical illnesses are not being identified accurately. And we're seeing cases that would be better handled in another venue sent to the physical care provider. And so they're tied up. I'm hearing that you can't get a doctor's appointment for 2 and 3 months now is a common complaint. And I think this definitely contributes to it. But this fear and pathologizing of emotions needs to change. We can do better as a society. And part of my mission is to normalize both the experiencing and the expression of emotions. Feelings are a healthy part of human experience, and they should be treated as such. All right, let's take a look at defining emotions. Just what are these pesky little things called emotions anyway? Well, literally, they are energy in motion. The E is for the energy, the M is for the motion. They're moving. We experience them as bodily sensations or what we call feelings. For example, if we're feeling tense, the muscles in our neck and shoulders or abdomen can tighten. We might clench our jaw. If we're feeling relaxed and calm, we're smiling and laughing. If we're upset, our chest could feel tight, or we could find that we're holding our breath. That's very common for people to be holding the breath and not even realize it. So these are ways that our bodies experience emotions. All right, let's talk about the purpose of emotions. Emotions are messengers meant to protect. They're actually a communication system that's trying to keep us informed about the current state of affairs in our environment, both internally and externally. Are we safe? Are we in danger? Is this experience I'm having with this other person painful or pleasurable? First, they're going to send a memo, like the check engine light might come on in your car. If ignored, friendly reminders start arriving, then repeated, increasingly urgent emails and letters are going to ensue, trying really hard to get our attention. They have something to tell us. Now, are they always correct? Do they always report in 100% accuracy? No, but that's really not their goal. They're telling us something's up, and it's up to us to investigate the validity or the meaning of what that something is. Just like the engine light that can come on in your car sometimes means there was just a piece of dirt or lint in the sensor and that nothing was really malfunctioning. It didn't get it exactly right, but it did report to you important information. So they're good to have, but we just have to understand that they have their limitations. Because they will not be ignored forever, eventually the body and or the mind and or the spirit or some combination thereof demands to be paid attention to. And that bill can arrive in many forms, many times in somatic complaints, soma meaning body, or in a mental health crisis. Thus, you can see that emotional shutdown or the inability to feel, or what some people call numbing out, is just as disabling to us emotionally as would be our physical inability to see or feel touch, to hear or taste in the physical realm. All right, now let's look at defining emotional health. First, let's just look at what health is. Health comes from the root word heal, and we're just describing a person's condition of their body, their mind, or their spirit. When I say spirit, I'm talking about soul or life force, that vital essence of who we are, however you decide to term that. Then, how would we describe good health? Well, good health means to be whole. There's no cracks or crevices. It's sound. There's a sense of well-being and thriving. It's not just the absence of disease or infirmity, but it's being able to do what we want to do and need to do in life. Then lastly, let's look at what emotional wellness or emotional good health looks like. And it has a few component parts to it. So it can be defined as understanding and having awareness of and having a comfort level with your feelings and being able to express and regulate emotions constructively in a helpful way. For example, it could be just something as simple as being able to say, I love you with authenticity and ease to your loved ones. It does also include the ability to manage stress and to cope with life's challenges. How hard or easy is it for you to handle everyday problems and crises? Do you feel like you're just pushing through mud to get through the day? Or are you just like, that's life, just let it roll off like water on a duck's back? Okay, so using the previously described definition of health regarding emotional wellness, can you see that a person can be unhealthy emotionally? They can be crippled, handicapped, just limping along in life and not be able to enjoy a fully functioning and vibrant life emotionally. So emotional health runs along a continuum or a range, just like physical health does. You can be in an emotional ICU at death's door, like this one lady looks like she feels, or you could be experiencing a minor annoyance, like if you had a common cold. It's something that needs your attention, but it doesn't debilitate you. Or you might be experiencing excellent emotional health, like this woman here that just looks like she's having a belly laugh and she's enjoying her life. I want you to take a quick self-assessment quiz here just to help you gauge and get a sense of where you are on the emotional health spectrum right now. I think this would be helpful for you. It's a very quick assessment. I have taken this from Princeton University's wellness program, 7 questions. And the legend that you're going to want to use to score yourself is if you never have this experience and you never have this emotion, then you want to circle a 1. If you rarely have this experience or it's a rare emotion for you, circle yourself a 2. If you sometimes have this emotion or this experience, you're going to land at a 3. And then if you usually have this experience or emotion, in other words, this is pretty much how you roll, then you're going to score a 4. Okay, so let's go through these questions. First of all, I find it easy to express my emotions in positive, constructive ways. Rate yourself 1 through 4 there. Secondly, I recognize when I'm stressed and I take steps to manage my stress. I've got some go-to that work for me to calm me down. There could be exercise. You might need to walk away to another room and have some quiet time, a meditation practice. Score yourself there 1, 2, 3, or 4. 3, I'm resilient and I can bounce back after a disappointment or a problem. How hard or easy it for you to bounce back? 1, 2, 3, or 4. Next, I'm able to maintain a balance of work, family, friends, and other obligations. Score your experience there. Number 5, I'm flexible and I adapt or adjust to change in a positive way. Maybe it's very difficult for you to experience change. Or maybe you're just like, that's how what your life is. Let me flow. 1, 2, 3, or 4. 6, I'm able to make decisions with minimal stress or worry. Go ahead and rate your experience there. And number 7, when I'm angry, and side note, we all have anger, whether we experience it consciously or not, and anger is a good thing. So that's the end of my side note. Further teaching to come on that in another presentation. So when I am angry, I try to let others know in non-confrontational or non-hurtful ways. Score yourself there. 1, 2, 3, or 4. All right, go ahead and just take a minute to tally up your scores, and then we'll look at the interpretation of the scores. So just add up all the numbers that you circled will give you your score. All righty, if your score fell between 20 and 28, then that means outstanding. Your answers are demonstrating that you're already taking positive steps in this dimension. Not only are you improving your own well-being, but you're setting a good example for those around you. Now, however, although you achieved a high overall score in this domain, you may want to check for low scores on individual items to see if there's a specific area you want to address. Or you could choose to focus on another area where your scores weren't so high. If your score fell between 15 and 19, this is telling you that your behaviors in this area are good, but there's room for improvement. Take a look on the items which you scored lower. What changes might you make to improve your score? Even a small change in behavior can help you achieve better health and well-being. Even a small change. If your score fell between at 14 or below, your answers indicate some potential health and well-being risks. You want to review those areas where you scored lower and review available resources, of which I'm about to give you some, to help you develop and set achievable goals in this area. Let's look at how to become emotional healthy 101, just the very basics. First, we have to identify where we are in order to even recognize that a change or a course correction is needed. Taking this emotional wellness self-assessment that we just did together is a good way to get you started toward an awareness of your current level of emotional functioning. Another good place to look is at the status of your relationships. Are your relationships healthy or are they hurting? And look at personal and professional relationships. Next, we've got to become willing to take an honest look at our life in order to become aware. You know, I put become willing on there because sometimes we're not so willing at the beginning, but if we can even open a corner of our mind and our heart to become willing, that's a workable place to start. If we don't become willing to be honest, otherwise there's this thing called denial. And that's an acronym for don't even know I'm lying. In other words, you're lying to yourself and possibly others. Truthfully, it's more like probably others, but you don't have a conscious awareness that you're not seeing reality for what it really is. Denial is actually a protective defense. It's also known as the shock absorber for the soul, and it's meant to shield us from unbearable pain, wherein we would otherwise be debilitated and not be able to continue to function. So we see this in action in cases of trauma or overwhelming life events where the person doesn't have adequate resources to handle the stress load that's been dealt them. And trauma, by the way, is very subjective. What we might think of as an adult is nothing could absolutely overwhelm and stress a child. However, after the crisis has passed or we mature into adulthood, denial has now become a hindrance rather than a help to our health. It's no longer protecting us. So continuing in that vein of denial will keep us emotionally ill, and we won't be able to experience vibrant emotional health until and unless it's acknowledged. Next up, you want to become educated on emotions, and emotional well-being. You know, you can read, there's many books on it these days. Emotional sobriety is one that comes to mind. Watch YouTube videos. Attend workshops and presentations like these. There's plenty of free resources available nowadays. Next up, you want to find a tribe to support your learning and growth. Now, just a note of caution here, this tribe can include friends and family, but often those are the very relationships that are the source of the trouble or the outlet for the trouble. So finding someone more objective would be my recommendation. At least let family and friends be an adjunct to your core circle of support. This could be a therapist, a free 12-step group. There's Emotions Anonymous. There's Codependence Anonymous. By the way, the criteria for membership in Codependence Anonymous is just to have a desire for healthy and loving relationships. Well, I don't know anybody that wouldn't want that, so I think we can all raise our hand and join that club. And then there's Adult Child of Alcoholics and Dysfunctional Families, or other support groups of various kinds. There could be a therapeutic support group. I did post the websites to these 12-step groups that I mentioned here for your reference in case you want more information, because all these have a lot of free literature and downloadable pamphlets and information. And they also have a search feature that you can try to find a meeting, face-to-face meeting in your local area or an online meeting. Next, you want to become willing to feel in order to heal. I know, it's a tough one, right? But when you go to your healthcare provider for any kind of care, whether it's physical care, mental health care, they usually always ask you this question: how are you feeling, right? So we use feelings, both physical feelings and emotional feelings, as a major tool to assess whether healing is occurring or not and at what pace. For example, in a physical illness, if you're feeling more pain or increased lethargy, or you're feeling like it's harder for you to breathe, then that gives your provider vital information on which they're going to make important treatment decisions based on. It's no different in the emotional realm. Feelings help us, or if we're working with someone, helps our provider to assess where we are emotionally so we can decide on appropriate interventions suited to the severity of our problem, what we're experiencing. So the sooner we stop resisting and accept and surrender to the fact that there is no other way to heal without feeling, and that it's a good thing, the sooner you're going to make progress. And here's where the supportive community can be vital, because this process can be very painful, scary, and difficult. And it's breath when we're stressed and we don't even know it. In through the nose, out through the mouth like a straw, 2 or 3 times or more, depending on the level of your stress. Things like EFT, or emotional freedom technique, or you might have heard that called tapping, or had experienced that to help calm our nervous system. A meditation practice, prayer, taking a mental health break, or you may need to walk away from the situation for a few minutes if the emotions are escalated. Give them time to settle down and then make a decision on what to do or whether to take any action at all. And then talking to someone. This is so important, because we can express those emotions, keep them out there, and by talking, it'll keep them from settling and storing in our body, which is not a good place for them. But these are all ways of assisting our nervous system that's been activated, if we're upset, to get back to its normal, calm state of functioning. In the medical world, we call it homeostasis, or it's just a place of balance. And next, we want to practice our new emotional skills: feeling, expressing, and regulating your feelings. For example, if you're learning to feel your emotions. I was in a session a few weeks ago with a woman who was crying as she was expressing what she was going through in her life. And she was crying hard. And I knew her history of her describing herself as hard to get in touch with her emotions and maybe numbed out. And so as she's crying, I was asking her questions, trying to elicit and get her to notice what she was feeling. I said, as you're telling this, what are you feeling? She was never able to identify it. It was very obvious to me that she was feeling sadness, fear, but this is a skill that she has to learn. So maybe expressing your emotions is a skill that you need to learn. Maybe you've learned this great new tool about being assertive, like saying, I don't like it when you don't take out the trash without being asked. If the only thing you've seen modeled in growing up in your family of origin is people screaming and yelling, and you come at this with the screaming, yelling in your face attitude, you're not going to get a very positive response from the other party, I don't imagine. So you've got to learn feeling tone, tone of voice. How do I say this? I'm going to say this in a calm, non-accusing manner. Timing. Do I start having this discussion when everybody's trying to rush out the door and have to be at work and the kids at school? This is something you have to learn. And then regulating your emotions, learning how to practice those tools that we just talked about a moment ago, the deep breathing, the tapping, the meditation practice, etc. And we want to practice these in order to refine them so we can be able to incorporate them as a part of our daily healthy life practice. Okay, I told you this was going to be a high-level overview, and that's it. So I am going to close this out right now. But I wanted to tell you that you are welcome to reach out to me if I can support you in experiencing emotional health, and I'm glad to explore with you how we might do that. You can email me at the email address I posted here, or call me at my office at 386-530-5818. Again, I want to wish you happy emoting and thank you so much for this opportunity to discuss emotional health and well-being with you all. Thank you so much.